The Department of Labor has released proposed rules to help implement the executive order on association health plans. I'm Bryn McBride of ABC for Health. You'll probably remember President Trump signed an executive order on association health plans and short-term insurance back in October. But when that was signed, nothing really happened. What it really did was tell the Department of Labor and a couple other federal departments to start working on regulations to sketch out what this new rule would look like. And the Department of Labor has done just that. This week, the Department of Labor has released their proposed rules, and they go into a little bit more detail about how association health plans will operate moving forward. So we're not going to talk about short-term insurance here. We're just going to focus on that association health plan piece. Now, the rules so far, as written, treat association health plans essentially like large employer health plans. So, as you'll recall, association health plans are those that exist right now and have existed for many years that let small businesses clump together and purchase insurance. What these proposed rules and executive orders do is change how the association health plans are characterized and, in its essence, sidestep some of the regulations and requirements that were traditionally attached to association health plans. So instead of treating association health plans like small businesses that have to follow the state regulations of small businesses, it lumps them together as large employer health plans, and now they follow some federal rules. So these rules that were written helped sketch out what it looks like to have a large employer health plan. Now, these are subject to federal ERISA rules, no longer state oversight, and therefore no longer Affordable Care Act consumer protections. And that was largely the political motivation behind these association health plans, is to sidestep some of the Affordable Care Act consumer protections, which some people said was driving up the cost of those plans, which they said burdened some small businesses. Never mind some of the tax credits and other subsidies available to small businesses. This was a motivator to try to get this through. It also allows some self-employed individuals to join association health plans, and we will learn more about that as that gets sketched out in the final draft of the proposed rules. Now, like I said, association health plans are not new in the insurance world. They fall under a benefit category called multiple employer welfare arrangements, where groups of small businesses can band together to negotiate, to buy health benefits, or to self-fund. Traditionally, these plans have had what is called a little bit of a spotty track record. Loosely regulated, undercapitalized. Some of these plans were unable to pay benefits depriving members of meaningful coverage. And now that they're in the world that will be exempt from Affordable Care Act coverage, they won't have to follow things like covering essential health benefits, which means they might not have to offer maternity care or newborn coverage. They don't have to follow medical loss ratios, and they could change more based on age, gender, or geography. They can change their premium ratings while excluding some benefits. So this is a big change. In the past, federal legislation in the 1980s placed association health plans under the purview of states to try to shore up some of these shortcomings of association health plans, the loose regulation and the undercapitalization. So the states have largely been responsible for making sure that these plans followed state regulations and consumer protections. Opening it back up to federal regulation is going to put us back into the bad old days of association health plans, loose regulation, undercapitalization, and most likely not following the consumer protections that patients should be entitled to. Now, impact. We're going to be diluting the number of healthy enrollees in the insurance market, individual market. That's what we're hearing from everybody. If you offer individual health plans, association health plans, and pull people out of the individual market that don't want to pay as much in premiums and not get as much coverage, you're going to be diluting the pool of the Affordable Care Act individual market, which means that's going to be a little bit sicker, more expensive pool. What we're also creating is two types of insurance at a larger degree than we had in the past, which means you're going to have different rules for different pools. You're going to have the insurance regulations with a lot of consumer protections and a little bit more expensive insurance in the healthcare.gov individual market, and the looser regulation, less rules, less protection, cheaper cost at the front for the association health plan rules. And that's why the dichotomy, and that's why people are speaking up against this. When you have that, you start driving up the premiums for comprehensive coverage, while the association health plans are offering cheaper coverage, but worse coverage. When somebody starts getting sick or starts going from a single unmarried individual to all of a sudden a married family now needing maternity coverage, and you've been paying your premiums, but that's not part of your plan. You have worse coverage that you've been paying into, and it's not going to cover your need. Those folks end up going to the emergency room, paying out of pocket, and contributing to uncompensated care if they can't cover those very large bills. What does this do? When you start creating different rules for different pools, you start going back into the pre-ACA chaos, which means destabilizing of the individual market. You return to the bad old days of insurance. We're not there yet. This has not been implemented. These are the proposed rules following the October executive order. We are in the public comment period that runs until March 5th. You can comment at the federal website, regulations.gov. There is a federal identifier. We give you that number to make sure that you can find the right Department of Labor regulation to comment on this. You can read that proposed rule yourself. We give you the link. You can also go right to regulations.gov, find that. You can read the details of the regulation, the proposed rule, right on the federal website. Share your healthcare story with us if you like, or send us an email or ask a question. You can do that at healthwatchwisconsin.org. Thanks for watching.